Hello, I'm Dr. Brinda, ENT surgeon from Bangalore Baptist Hospital. Today I'll be giving you a briefing about OSA or obstructive sleep apnea. It is a sleep disordered breathing where there's obstruction to person's breathing when he's asleep. So there are three components to OSA. One, snoring. Two, cessation of breathing or pauses in breathing, which we call as apnea, lasting for a few seconds. Three, daytime sleepiness. So what are the causes for OSA? So first and foremost, it is obesity or overweight. Second, it can be anywhere in the nose or in the throat. In the nose, it can be due to deviated nasal septum, where where the bone between the two nostrils is deviated to one side, or it can be due to nasal polyps. In the throat, it can be due to bulky tissues in the throat itself, a bulky tongue or big tonsils. And in children, particularly, it is the adenoid hypertrophy. So, what are the implications of OSA? First, the first thing is due to fragmented sleep pattern, patient can feel sleepy during the day, and it can have serious implication, especially when he's driving, when he can fall asleep and cause accidents. And besides that, early morning headaches, irritability, poor efficiency at work, all these are related to OSA. And in addition to this, medical problems like hypertension, diabetes, stroke and heart disease are more often in OSA. So how do we diagnose? First is clinical presentation, and two, we do office endoscopy in the ENT OPD where there's a scope passed from the nose into the throat, and this helps us to determine the level of obstruction. And thirdly, it is polysomnography or sleep studies which can be done at the hospital or at a home settings. Here the patient's parameters like pulse, BP, breathing pattern, apneic episodes are all recorded. Now coming to the treatment aspect, if the patient is overweight or obese, the first and foremost thing to do is to cut down the weight with diet and exercise regimen. Two, there is something called CPAP therapy or mask therapy. Here the air is blown in, patient is made to wear a mask and air is blown through this mask into his airways, keeping it open. And third is surgical treatment. As mentioned earlier, if there are surgical conditions like deviated septums, polyps or tonsils, it can be corrected surgically. Thank you.